What is chikungunya? Chikungunya, CHIKV, is a virus that spreads to people through mosquito bites, specifically, through the Aedes aegypti mosquito and Aedes albopictus mosquito. Chikungunya infection happens when a mosquito with the virus bites a person. The virus doesn't spread from person to person through bodily contact or saliva, although blood transmission may be possible. The virus causes symptoms like fever and joint pain, which can become severe. The name chikungunya means, bent over, due to the joint pain the illness is known to cause. There's no medication to treat chikungunya. Treatment focuses on managing your symptoms. Most people recover from the illness in about 1 week, but some have lasting joint pain. People traveling to areas with active chikungunya transmission should be overly cautious about avoiding mosquito bites. It's especially important to avoid getting more mosquito bites for about 1 week once you have the virus. This is because an uninfected mosquito could bite you and become infected, further spreading the virus. How common is chikungunya? Experts believe the number of cases is underreported because its symptoms are similar to other diseases. Once only in Africa and Asia, the virus is now global, affecting more than 110 countries worldwide. Are chikungunya and dengue the same thing? No, they aren't the same virus. But the same species of mosquitoes spread both diseases. Dengue also has similar symptoms to chikungunya. Zika is another virus that has similar symptoms and transmission. For this reason, healthcare providers may suspect all three viruses if a person has certain symptoms and has recently traveled outside their home country. What are the symptoms of chikungunya? Symptoms of chikungunya usually develop between 3 and 7 days after an infected mosquito bites you, although some people have symptoms as early as 2 days or as long as 12 days after a mosquito bite. Fever and joint pain are the most common symptoms of chikungunya virus. The intensity of symptoms can vary depending on the person. Many people feeling crippling joint pain. The fever usually begins suddenly. Some people can have such mild symptoms that they mistake the virus for another illness or don't visit a healthcare provider. Other symptoms could include headache, muscle pain, swelling in your joints, rash, fatigue, nausea. Most people experience symptoms for about 1 week and go on to make a full recovery. Although some people have chronic joint pain after recovery. What causes chikungunya? Getting bitten by a mosquito that's infected with the virus causes a person to get the virus. The virus spreads through mosquito bites, not from person to person through bodily fluids or contact. This means if you're sick with chikungunya, you won't pass it on to a caregiver or family member. There have been reports of healthcare providers getting the virus after handling the blood of an infected person. This means transmission through blood is possible, but rare. Is it contagious? Chikungunya spreads to people through a mosquito bite. A person with the virus can't pass it to another person through bodily fluids like saliva or by sneezing or coughing. The virus spreads only through an infected mosquito. The risk of a person transmitting chikungunya to an uninfected mosquito is highest in the first week of the illness. What are the complications of chikungunya? The most common complication of the virus is chronic joint pain. Some people report pain for months or years after chikungunya infection. Newborns, older adults, 65 and older, and people with certain health conditions are at risk for more severe complications from the virus. These health conditions include diabetes, high blood pressure, heart disease. Death from the virus is rare. There have been several cases where a person reports ongoing heart, eye or neurological symptoms after recovering from the virus. How is chikungunya diagnosed? Let your healthcare provider know if you have symptoms of chikungunya and recently traveled to an area of the world with known chikungunya transmission. They can also order a blood test to diagnose chikungunya. How is chikungunya treated? There are medications that treat chikungunya. Treatment focuses on managing a person's symptoms. This includes drinking plenty of fluids,